Hi, everyone, and welcome to North Star Physical Therapy Podcast, and welcome back for those that have been listening to prior podcasts with me. And so I really appreciate all your love and support and just spreading the word. Help me, help you, help me spread medical knowledge and advocacy for your own pelvic and lymphatic health. We are releasing this podcast within the month of May to just continue the emphasis this month on those that were born with vagina and vulvar tissues and have estrogen as a dominant hormone. And for those that are going through with this episode, we're going to be focusing on perimenopause. So when I say perimenopause, that means your time frame between really menopause is after 12 months without a menstrual period. And so that's when menopause is. The day after is postmenopause. But menopause symptoms can start as early as potentially 10 to 15 years prior to menopause. So when you think about that, the average age of a woman going through menopause happens right around their 50, 51. Symptoms can start as early as in like their late 30s, early 40s. And so we want to really embrace that as your body changes, really listening and paying attention to that, and what are some pelvic and lymphatic health considerations during that time frame. So perimenopause can be anywhere from that kind of you're in the thick of your menstruating potential pregnancy years to pre-menopause and post-menopause. And it's a long time, right? It can be a long time. A lot of this is really related to your genetics. So if you are someone that has a vagina and ovaries and estrogen as your dominant hormone, then I encourage you to hopefully ask the questions and talk to other females within your family, your mom, your aunt, your grandma, just to ask them the question of, hey, what kind of symptoms did you have? About when did it start for you? Because it's probably going to be pretty similar. Genetics are a really big role here. However, everybody is a little different, just depending on your personal health and hormonal health versus and your activity level, your nutritional health, your gut health, all the things do play a role in this as well. So there are some women as well that have maybe children a little bit later on and they get pregnant into their mid to late 30s, early 40s. Totally fine. Not a problem with that. However, they may have a little bit more of considerations for the postpartum journey because they may also be perimenopausal. Okay. So we have to consider those things. So feel free to take a peek and listen to my previous podcast talking about peripartum time frame. But for this perimenopause, we want to really consider there are natural aging processes like our skeletal muscle strength does start to decline here. Your bone health does start to decline, and your absorption of nutrition and how we metabolize things either slow down or reduce down. That's where gut health and hormonal health are so very important. How I tie this into pelvic health and lymphatic health is just that, right? So in our gut, in our belly, in our abdomen, in our pelvic cavity, pretty much everything from rib cage to pelvis, right? All that area does have a very vast supply of lymphatic tissue and lymph nodes and lymph vessels. And your gut has its own lymphatic system, just like how your brain has its own lymphatic system and flow. And if we have some congestion here within our lymphatic system, we quite literally could have abdominal swelling, and reduction of that fluid flow could bring on some more bloating symptom, could increase any kind of swelling within the abdominal cavity, maybe even into our legs. We could have potential pelvic congestion going on, so feel free to listen to that podcast all about that. But your lymphatic health within this area is definitely important. If we have really high inflammatory foods, or we're not as active in getting this area moving and pumping, then that could also give rise to some of these kind of bloated heaviness, swelling, like slow gut motility, things like that is related to your lymphatic health. So as a lymphedema therapist, within this time frame, especially for women that tend to maybe add on some more like visceral or abdominal fat, we want to really see, is it truly that fat and that absorption of that fatty tissue, or is it a little bit more of the swelling? And so we work on some decongestion of the abdominal region, which is where our extremities flow to anyways. So if our abdominal region is congested, you can now understand that potentially more pelvic and leg congestion can occur, potentially more arm and chest congestion can occur. And so as a lymphatic therapist within the perimenopausal space, I add in manual lymphatic drainage as a part of the overall wellness of that area during this time. A big consideration with your pelvic health within this perimenopausal time frame is what is happening with our tissue changes as our hormones are adjusting and potentially reducing in estrogen and progesterone. There are some tissue changes that occur within the vulvar tissues. They become potentially like drier and thinner. They lose some lubrication. They could have some pelvic pain when it comes to penetration or with urination, like a burning, but there's no UTI that's present. It's negative testing for any infection. There is maybe some pain with penetration. There is that, again, that vaginal dryness and itchiness. And so those are huge signs of that we maybe need to consider vaginal estrogen to be applied to this area to really help with those vulvar tissues to reduce the likelihood of UTI, to reduce pain with penetration. And that can be penetration for sexual activity, or that can be penetration for a pelvic exam. That can be penetration for any kind of menstrual device that you use, a tampon, a menstrual disc, a menstrual cup. So there's more than just with our partner, even though that is very important, but there are monthly things that we need to take care of. And so within the perimenopausal space and time frame, we really look at what is our pelvic tissue health looking like. How is the flexibility of those tissues? How is the strength of those tissues? Because those are skeletal muscles in there. However, those muscles are oriented in a very different way than, let's say, your bicep or your quads or hamstrings. Whereas those muscles are very linear, right? They have a point A and a point B, insertion, origin, attachment sites, and they move in like kind of one direction. Whereas our pelvic floor muscles, there are external layer, there is an internal layer, and there's even like a fascial layer in between and in throughout. And it is more quite literally shaped like a bowl. It is circular like that, but I want to think of it more as a trampoline of how those tissues need to be flexible and strong. Within the natural aging process, the skeletal muscles do lose strength. If we don't use it, we'll lose it, kind of thing. So that doesn't necessarily mean that everybody just hop on, do Kegels, right? This just means that to get a pelvic exam to see how your muscles are doing, and make sure your pelvic floor therapist also treats with good creativity, right? As well as getting you in the positions where if you have any symptoms, you're being assessed there. So if I'm assessing somebody for just overall wellness, we may start off on our back, like doing a pelvic floor exam, much like an OBGYN. However, if I'm asking the questions, we have some urinary leakage, or we have some trouble with defecation, or we have pain with penetration, or you only leak when you're jumping and coughing or sneezing, but when you're standing, we want to get in those positions and see what the pelvic floor muscles are doing. They're very much interconnected. They're that trampoline, but they share common attachment sites and fascia connection with our abdominals, with our glutes, with our thigh hip muscles. And so if those muscles are turned on, we want to see, was there tension created? Is the pelvic floor actually turning on during this? Not just every time we're laying on our back, right? So we do want to assess the tissue integrity externally, but also internally of how is the strength, how is the flexibility, how is the endurance, how is the coordination with movement, how is our positioning like with our hormones potentially are changing, the tissue elasticity and flexibility changes within our ligaments and our tendons, which is what the muscles attach to, which what the bones are attached to. And is there some joint stiffness going on within not only our pelvis, but our hips, our low back, our mid back? How are we supporting our soft tissues with our breast tissue while we're jumping, running, and doing our activities? How are we supporting our feet and that soft tissue when we do our walk, when we do our run or jump or running after our kids or our dogs or whatever? We want to make sure all of our soft tissue is well supported. So we do need to look head to toe. I often tell folks whenever I'm looking at pelvic health, I'm looking from pretty much your neck to your knees, right? However, I do need to look down at the feet and how are our feet well supported? Do we have good footwear? Are we walking with a good gait cycle? Or do we need to work on some ankle strengthening and musculature down there so that every time you take a step, every time you jump, every time you run, that ground reaction force, remember high school physics and everything, right? So that impact of stepping maybe heavily or jumping or hopping during that CrossFit, again, whatever activity may be, that the muscles are acting the way they should as a good shock absorber up the chain versus just going straight up and right over to the pelvis and poor pelvic floor and takes the whole brunt of that pressure. We have to keep in mind that when we are sitting, we're automatically putting pressure down into our pelvic floor all the time, all day long. And then when we stand, there's even more pressure going through our pelvic floor. So our pelvic floor is already on and active. It's just how much more do we need to draw upon it when we need to with these higher impact things or higher pressure things like sneezing, coughing, jumping, running, all those things. And with natural tissue changes that happen within the perimenopausal space because of hormonal changes, this can impact that. Whereas maybe 20 years ago, you had no problem jumping, running. Even 5 years ago, you had no problem doing these activities. But then now, all of a sudden, quote unquote, we have these issues where there probably were things throughout that timeline that were just little indicators of, oh yeah, I did have some UTIs, or I was having some discomfort with penetration, or yeah, pooping, that bowel movement was just getting a little bit harder and harder to fully empty. Or I got so busy with work, I changed jobs and I'm not drinking as much, I'm not urinating as much, I'm getting up at night all the time. There are different external stressors that we have to appreciate that affect the pelvic floor. We have to appreciate whatever those external stressors change within your lifestyle and how that can impact your pelvic health and your lymphatic health for any kind of inflammatory things. Within the perimenopausal space and time frame, there are a lot of factors that can tie into maybe some of these symptoms, and you can absolutely work with a pelvic floor physical therapist and a lymphatic therapist to help address all of these contributing factors within their scope of practice. And luckily, I am both, right? So that's how I'm able to combine my specialties to really treat holistically with that of, okay, what is our lymphatic system telling us? What is our pelvic health telling us? What is our body telling us? And what is our goals? And then what is our lifestyle like? What are these contributing factors? Think about it. When you are in your mid to late 30s through your 50s, so much life happens, right? You're not in high school anymore. You're not in college. You're not brand new into the work environment. You're like pretty solid in your lifestyle, whatever it may be, which is great. However, life happens, right? There may be potentially expanding a family and children. There may be changes with your work environment or work stressors. There may be changes in your family. Maybe there's an expansion of families sometimes, or there's death of the families, or there's dramatic moves that happen like across country, or you're in that sandwich generation where you're taking care of your kiddos and what your parents seem to be taking care of. It's a lot of life that happens. And so there are a lot of stressors, and that's where I always like to capture some level of active stress management with all my clients of we're probably never going to be this kumbaya, we have no stress, right? Is what do we do about it? What works best for you? Is what kind of relaxation or breathing technique, or what kind of like maybe active, like I need to go work out or go for a walk, get out there in the sun, get a little vitamin D, get some fresh air, things like that. There are just a variety of things that we can do to help control our nervous system in this area. That if our nervous system is heightened, really high fight, flight, or freeze going on, that can increase our inflammatory response, which increases the fluid into the lymphatic system, which makes it work overtime and potentially congested. It also potentially, maybe you're in pain and you're stressed out and you guard and you tense up your pelvic floor muscles. Then it makes it difficult to maybe defecate, or it's painful with any penetration, or we maybe leak because we're very tight. And so you can just appreciate, just off of that pure example of just an increased stressor, how that impacted both lymphatic and pelvic health system. So perimenopausal time frame is tricky. There's a lot of stuff going on, but we are here for you at North Star Physical Therapy to help guide you through what are those considerations, what are those contributing factors, and what can we control, and the controllables that we can do. What are things that we can adapt to? What are those contributing factors that we can really make an impact on? What are things that we need to advocate for within our own health? Do we need to discuss potentially hormone therapies or vaginal estrogen, or even just nutritional considerations, to maybe work with a nutritionist or a diet or a functional medicine provider to look at our hormone panel, to look at our blood work? What do we need help with? Our bodies haven't evolved as fast as the world and technology has. So we have to appreciate that people decades ago in the same age were very different health because our lifestyles have changed, right? The advent of technology, the advent of convenient foods, the advent of, again, like computers, right? And that technology and sitting, right, has increased way more over the last few decades than it was back in the 30s, 40s, 50s, right? So things definitely have changed, and so is our healthcare trying to change with it, but you have to be an advocate for yourself. And all that being said, I come and conclude that for those that are going through this time frame between like menstruation through perimenopause, menopause, and postmenopause, there are pelvic health and lymphatic health considerations, and make sure you're being an advocate. And feel free to check out my website and sign up for a virtual consultation. I can walk through with you these steps or things to consider that's a little bit more individualized to you. And so I do offer that virtual service here at North Star Physical Therapy. So please feel free to email and send me any questions, comments about this podcast, or any of them. I always welcome great feedback. And if there's any topics that you want to hear about, I'm here for you. So until next time, everybody, happy May, happy lymphatic and pelvic health.